Hey, good evening, everybody. Joe Fazio, along with some friends in the sporting world. There's a lot of former professional football players and a professional baseball player. And I've got my good friend and business partner, Dr. Tony Smith from Southern California, on the line here. We are here to talk about this incredible, newly patented medical device called X39 stem cell reactivation technology. What I didn't realize is by the time you turn 60, most of your stem cells go dormant, if not all of them. And what can you do to revitalize, to bring those dormant stem cells back to life? So I'm pleased and privileged to have my friend Dr. Tony Smith. He is a chiropractor. And Dr. Tony, just a quick background on what you do, who introduced you to X39. What did you think about this technology at first, and where has it taken you and your family these last few years? Dr. Tony?
Okay, thank you. Thank you for the invitation. Glad to get on here, excited. So I'm a doctor of chiropractic. I'm actually in a multidiscipline facility where we have orthopedic surgeon, podiatry, pain management, general physician. So I see a gamut of healthcare approaches and different things. And I've been in sports medicine for 32 years now. I was a athlete going up through college, and so I spent some time in the training room as well, probably as like most of us, so we learn a little bit the tricks and trade of the trade and different things. So I was actually introduced from a friend of mine, Mike McCleary, who was actually tracked down by Andre Davuti out here, and he actually avoided him for about a month's time, or maybe even longer than that, and tried to slip away from him. But Andre finally tracked him down, caught him at a Starbucks one day, and so Mike and I are good friends. Andre shared his testimony about a diabetic neuropathy after cancer treatment, and had a diabetic ulcer on his foot that wasn't healing, and then he got introduced to the X39, and within like 24 hours, his pain dramatically decreased. His ulcer didn't. It took a period of time, but his ulcer started healing, and eventually healed up, and they were looking at amputating, some toes initially, and then, part of the foot because it wasn't healing. So that caught Mike's attention. Mike actually got some samples from Andre. He was actually leaving town like in 2 days to go to Germany for about 2 weeks. And so he shows up on my doorstep and says, "Hey, my friend gave me some of these X39. You need to take a look at them," and said, gave me, a website to check out. And he said, "It's stem cells, something or rather, something to do with light." And like, I'm like, okay, he just kind of, so really he just dumped it in my lap, and he's like, "Do your research, do your, let me know when I get back." And so I'm like, okay, let me check it out. And so, I started digging into a little bit because, in our practice, we do stem cell injections, PRPs, we do all this stuff, the fancy stuff. And so I knew a little bit about what, stem cell caught my attention. I knew a little bit about that technology. Um, I also knew a little bit about light therapy for the fact that I've actually been using cold laser light therapy to accelerate healing properties in athletes for the past 15 years. But those particular units cost $18,000, and I can only work on one person at a time. And the cost of a month's supply was what we charged for one visit when they did this. And I started kind of digging into the research, the technology of light, what we're doing, kind of the similar properties that we're activating and accelerating healing. And I'm like, and then it hit me. I'm like, so I can put this patch on hundreds of people or thousands of people and show other people how to do the same thing, or I could treat one person at a time for 20 minutes and only be, it just seemed like, okay, I can touch a lot more people with this patch. The thing came down to was, does it work? Does it work? Like, because I'm practicing in the town that I grew up in. So I'm on-field doctor for football. I do sports physicals for 9 high schools out here. So my credibility means a lot to me. So I'm not going to introduce something that I don't believe in and bring to the market. And so I did, kind of behind the scenes testing, if you will, or I started sharing it like we all do. I started sharing with some friends and family. I wore it myself. I'm actually a competitive cyclist now. I actually compete in the Masters division, and I ride about 250 to 200, 300 miles a week. So I put in some big miles. So I was actually looking for things to enhance my recovery, my ability to push myself further, like all athletes want to do. I'll tell you the biggest controversy is when I started seeing the benefits of being able to recover faster, to push myself a little further in my workouts. I'm like, do I actually go out and share it with people I'm competing against? That was the biggest dilemma for me is like, do I want to share it with anybody that I got to, we're competitors. We don't want to give anybody the upper hand on us, right? We're not going to, so I'm like, yeah, I don't know if I do that. I'll share it with my patients, but I'm not going to share it with my competitors.
Well, I
But
think that's probably why Stanford University, they put 59 athletes on the most recent Summer Olympics. They don't want to tell the other colleges because,
exactly.
they're dominating. But Dr. Tony, when I first started wearing this patch, and thank you for that background, I had debilitating pinching sensation in my back, and it went all the way down my glutes to the back of my knee. And I would literally be traveling through airports, drop my luggage. I'd have to crouch down like a baseball catcher and just stretch out that nerve route. And I thought, I'm going to give this a try. Within 21 days, Dr. Tony, I'm going to say the word sciatica, that pinching sensation, it totally went away. And I thought it was a fluke. I thought maybe that sensation was going to come back. I didn't think it was, gone. And I remember asking you, did it just mask the pain? And
Yeah.
and tell me what you said about that nerve route.
So basically, I see a lot of patients like that have stenosis, constriction around the nerve root, calcium buildup, and disc degeneration. So there's basically what you have a confined area where the nerve root's going through, and not a lot of room for it to move around. And so you move certain positions, and the nerve root gets pinched. Well, once it gets pinched, that nerve root swells up in a
Mm,
confined area. So it's like a dog chasing his tail. It's all constantly getting irritated and pinching. It's hard to break that cycle. A lot of people do it with steroids and different things like that, corticosteroids and stuff to reduce it. But long-term use of that can be harmful to other issues going on in the body.
mm,
Um, but what basically is happening because of the X39 and some of the properties, like was mentioned just a little bit ago, what they call copper peptides, which are healing peptides or proteins that our body absolutely needs to rebuild and regenerate, is that one of the components of what copper peptides do is reduce inflammation. And so inflammation is a significant factor in a lot of our health issues and challenges because one, inflammation is root of all disease. And so that's a big factor in overall health and wellness. But kind of in that particular fashion is that it was able to, over a period of time, not overnight, but over a period of time, enhance the body's ability to break down inflammation and help reduce that inflammation. So it actually was allowing the body to get back ahead of the game again and not allow as much inflammation to occur in that region to where basically turn on the systems so our body can start to heal itself more effectively. Like when we were younger, we recovered a lot faster after game night, right? Over the weekend and maybe a couple hot tub or cold ice baths and stuff. But we used to recover. Now it'd take weeks for us to recover from a game
yeah.
playing at that high intensity. So the whole thing is that I just tell people the patch itself is turning on systems that we used to have that worked very effectively when we were younger, but has dramatically declined over time. So it's basically like going back and turning the light switch on those properties and those systems, something that's already within us, but has gone dormant. And so it's just kind of awakening those systems to work again. So it's not taking external sources, it's not taking weird chemicals or synthetic things. It's actually turning our own body system on. And the best way our body can utilize something is when our own body produces it. Because you can take exogenous, what they call outside sources of collagen. You can take outside sources of different things, amino acids. But if your body can start to produce those things naturally, our body knows how to effectively use them more appropriately.
Mm,
And so that's why I'm so excited about this, because I've been in health and wellness and nutritional supplements for 30 plus years. And so we have, a lot of different natural things, and we have synthetic things that we work on this. We'll give somebody something for this particular issue, and, maybe a kidney issue, maybe a back issue, inflammation, whatever. And there's a lot of different supplements that we're doing for now. I can offer people, like, do you want a handful of this you take twice a day, or do you want to wear this patch, put this patch on? 10 out of 10 times everybody's like, I'll wear the patch, every
Mhm.
day, all day, rather than take a bunch of supplements or medications or things like that. So
Yeah, that's great. A lot of football players, Dr. Tony, have had a lot of head collisions, and the word concussion obviously is a big deal, especially in football. We think the NFL is kind of trying to keep that under the radar, all the different concussions that are going on. And there is a very chronic disease that's kind of prevalent, but nobody wants to talk about it, and it's called CTE. So can you talk about how this brings the brain back into balance, and will it? Because we've got a couple of teammates that were experiencing symptoms of CTE decided to put on the X39 patch on their body, and now they're no longer experiencing those symptoms. It's pretty fascinating. Do you have any experience with concussions?
yeah, I see a lot of, I mean, not as many as we used to, but I see more concussions with, yeah, with athletes and stuff, being an on-field sideline doctor now.
Mm.
But yeah, so basically it kind of brings things back into harmony, like into balance. But one of the biggest thing is too is inflammation, the inflammation in the brain in that sterile area, things, there's not a lot of things across the blood-brain barrier except, when you apply trauma to it. And so you have, a lot of inflammation in there, and that starts to obstruct the communication of the nerves and everything, all the function and blood flow, circulation, a lot of different factors that go on in the brain. And so, because of helping to reduce inflammation in that sterile and in that, in the brain, and also increasing blood flow and circulation, good blood flow, and kind of with the vascular, blood flow, the vessels being more compliant now. So you're getting better blood flow, better circulation, allowing more nutrients to come in and to replenish the area more effectively. So it kind of just has a compounding benefit of enhancement over a period of time. It's not something, again, overnight, but over a period of time, people are starting to see a lot of significant benefits. And then also some of the hormones, like kind of the mood, we talk about enhancing mood because there's PTSD stuff that goes on. We've seen like in military
Hmm.
people getting, kind of getting back on track and not as aggressive behaviors, kind of getting back in tune with. So it has a really powerful systemic effect. It kind of works, like I said, throughout the body.
Mm.
And so, and just to kind of helping you balancing out the hormones and things that are going on as well.
That's great. Dr. Tony, this is actually a very unique financial opportunity too. In fact, I studied business at Notre Dame's business school. This meets all my criteria for a blue ocean strategy, which means we don't have a whole lot of competition. We have 15 more years of patent protection. I think a lot of people are fed up with Western medicine and big pharma, and this is a natural way to wake up your stem cells that have gone to sleep. Has this helped you and your family's financial trajectory?
Yeah, dramatically. So what I tell everybody, when in my team, when I go out and talk to them, is that there's not a person walking this earth that doesn't have a declining number of stem cells in their body. As we age, we know that they decline, and there's nothing on the market that turns this back on, that turns that stem cell production and those copper peptide production back on like this does. And there's no other company out there. Everybody walking this planet, and pretty much every animal, walking the planet, can benefit from the X39 and the qualities that it does, the benefits that it has, and nobody else has access to it or the ability to create it except for people associated with the company. Meaning that, I mean, right now, probably 10 out of 10 people you go talk to don't even know what X39 is.
Mhm.
But they've heard something about stem cells. Maybe they've even heard a little bit about peptides. Regenerative wellness is going towards the thing of peptides, different type of peptides, healing proteins, but they're being synthetically produced to mimic what our body's production of them. So we have something that's natural, that's enhancing, that has no detrimental side effects because there's no chemical interaction with any medication that's out there that people are taking. So it opens, I mean, it's a wide open arena that, like you say, blue fish, or I'm not much of a fisherman, but I kind of get the gist
Blue
that
ocean.
there's blue ocean, whatever. There's nobody else in the market that's trying to penetrate, the market besides us. I mean, and so everybody can benefit. Nobody knows about it. and it's a wide open, and we're 82 countries. So meaning that it's really hard to even expand, into one country. Now we're in 82 countries. So you can have an international business from the comfort of your own home. And everybody needs to know about it. And so that's our mission and go. But I mean, literally, I've been able to help. I mean, it is kind of being recorded. Let's see. I've been able to help people, my team, make multiple six figures off of this, and myself, and basically matching what I do and above the income that I make as a doctor on a part-time basis, built around what I already do. And so multiple six figures, everybody needs it, everybody can benefit from it, and nobody knows about it. So it's a huge opportunity to go out, and it starts by just, introducing it to people, and then finding the ones that want to see. A lot of times, and I'll share this, I share this with my team as well, is a lot of people approach from the product side of it because it's a safe approach. Everybody, wants to feel better. But there's like, Joe's a business guy. He goes, hey, if I have something that everybody can benefit from, but nobody else knows about it, nobody else has, this is a huge business opportunity. Are you open to making more money? I mean, I try to teach people how to introduce that, because the thing is, when there's something that everybody needs, everybody can benefit from, but nobody knows about it, that opens the arena for everybody to make money off of it. And so we just have to we kind of got, I know it's an uncomfortable way to do it, we just got to learn. We got to get over stumbling blocks. Sometimes we've got to get a little uncomfortable to make gains, to grow, to grow ourselves. And so that is the thing, is that getting that, because it can bless, it can bless a lot of us. We can bless a lot of people in these untrying times. I always, there's a lot of financial insecurity going on right now. So we need to make things a little bit more secure, and we can't necessarily rely on government or anybody else. We have to go out and create it ourselves. And so again, when we're going out and helping and impacting people's lives, I mean, that's why the company is the #1 company in the industry, and for the last couple of years in a row, is because of the lives that we're impacting. And we're still, even though we're impacting so many lives and the company is growing this fast, again, 10 out of 10 people don't even know about it yet. So it's still a wide open market, even though it's been around, a couple of years now, 2.5 years, whatever, 3 years. It's still wide open. I mean, you can own your town, your county, your state. You can own a country. You could be the leading distributor in countries right now, because again, nobody knows about it. And I mean, I have some people in my team that have never done this type of business before. First, had no idea. They introduced it to a person who introduced it to a person who took off, and now they make let's see, they make multiple 5 figures a week. I don't know, multiple 5 figures a week. They could literally buy a nice car every month. How's that? How's that? They can buy a nice vehicle every month off what they make from this. And they don't even really know how to do this business. They just started sharing it with people, and it took off. And so you never know. It's not necessarily who you know, it's who other people know, and then they just start to run with it. So you never know how far it can go, and we've been fortunate enough to have a couple of people in our team. I didn't personally know, but have just taken off with it and have created a huge, massive business from it. And so it started with, we had to open our mouth first, and then show other people how to do the same thing. But I tell you, man, it's life changing if you can take it to that extent and go out and just from your heart, go out and help people. If you approach it from the point of helping somebody, take your eyes off yourself, help somebody else, whether it's to meet their mortgage, to make their gas bill, buy a safe car, or whatever it is, put their grandkids through private school, get them into Notre Dame. I don't, if they didn't go on scholarship, pay their way through Notre Dame or wherever, whatever your motive is, but help somebody else do something great. It'll come back in return.
Excellent, excellent. That's why we call this a double barrel blessing, ladies and gentlemen. We are having so much fun blessing people, both from a health perspective and also financially. Dr. Tony, I want to thank you for being our guest tonight. We're going to open it up for Q&A. I'm going to go ahead and stop the video. Gentlemen who are on the call, thank you for being here. Let's open it up.